Have you ever wondered why healthcare providers become extremely concerned when a patient's troponin level is elevated? Or maybe you've heard the word troponin doing clinicals, but no one really explained what it means in simple terms. Well, today we're going to break it down clearly and simply so that you truly understand what troponin is, why it becomes elevated, what it means clinically, and the most important nursing priorities that you will need to know for exams and the NCLEX. By the end of this video, you'll understand troponin in a way that finally makes sense. Hi, everyone, and welcome to Clever Concepts Academy, where we simplify difficult nursing concepts to help you succeed in nursing school and prepare for the NCLEX. If that sounds helpful to you, be sure to subscribe and let's get started. So first, what exactly is troponin? Troponin is a protein. It's found inside the muscle cells. Its job is to help the heart muscle contract properly. Now, under normal conditions, troponin stays inside the heart cells. It's not supposed to leak into the bloodstream. But when the heart muscle becomes damaged, those cells begin to break apart and troponin leaks out into the blood. That's why troponin is considered a cardiac biomarker. So what exactly is a biomarker? A biomarker is simply a substance in the blood that gives us information about what is actually happening inside the body. And one of the most important reasons troponin becomes elevated is because of heart muscle injury, especially during a myocardial infarction or heart attack. I want you to think about it in this way. Imagine the heart muscle cells are tiny water balloons filled with troponin. If the heart muscle is healthy, the balloons stay intact. But if the heart muscle becomes injured from lack of oxygen, the balloons begin to burst and troponin spills in the bloodstream. That is exactly what healthcare providers are monitoring. Let's talk about why troponin becomes elevated. The biggest cause is a myocardial infarction, also known as a heart attack. During a heart attack, blood flow to a part of the heart becomes blocked. Without oxygen, the heart muscle begins to die. So as the cells become damaged, troponin leaks into the blood. But here's something very important for nursing students to understand. An elevated troponin does not always mean the patient is having a heart attack. This is a major NCLEX point. Troponin can also increase in heart failure, sepsis, pulmonary embolism, kidney failure, severe hypertension, myocarditis, and even prolonged tachycardia. The bigger question is why? The reason is because all of these conditions can place stress on the heart muscle or reduce oxygen delivery to the heart. So healthcare providers do not diagnose a heart attack based on troponin alone. They look at several other parameters. For example, the patient's symptoms, ECG changes, troponin trends, patient history, and their overall clinical presentation. Here's an NCLEX tip. Never assume that one elevated troponin automatically confirms a myocardial infarction. It does not. Always assess the full picture. Now, you may be wondering, what is considered a normal troponin level? The exact values vary slightly, depending on the laboratory and the hospital system. But generally speaking, troponin should be very low or undetectable in healthy individuals. What is often more important clinically is the trend. Is the troponin rising? Is it falling? Or is it staying stable? For example, if a patient's troponin goes from 0.03 to 1.5 and then to 4.2, that rising trend strongly suggests an active muscle injury. That's why healthcare providers often order serial troponins every few hours because they're looking for patterns. Patients with elevated troponin may experience several symptoms, such as chest pain, chest pressure, shortness of breath, diaphoresis, nausea, fatigue, dizziness, or pain radiating to the jaw or arm. But remember, not all patients present the same way. Women, older adults, and patients with diabetes may have atypical symptoms. Sometimes the only symptom may be fatigue or shortness of breath. That is another major NCLEX concept. Now let's discuss the nursing priorities. This is where students often struggle because they memorize laboratory values, but forget what to do about it. If a patient has an elevated troponin, your priority is to assess for signs of decreased cardiac perfusion and worsening instability. Some of the important nursing actions include assessing for chest pain, monitoring vital signs, obtaining ECGs, administering oxygen if indicated, monitoring their cardiac rhythm, assessing for shortness of breath, preparing for additional cardiac testing, and notifying the provider of critical changes. You may also want to monitor the cardiac rhythm for abnormalities and signs of cardiogenic shock. Patients with elevated troponin levels may also receive several drugs such as nitroglycerin, aspirin, anticoagulants, beta blockers, or morphine, depending on the situation. So as the nurse, you must monitor carefully for hypotension, bleeding, dysrhythmias, and worsening symptoms. Here's an NCLEX prioritization tip. If NCLEX were to ask, what patient should the nurse see first? And one patient has chest pain, diaphoresis, shortness of breath, and an elevated troponin. That patient is often the priority. Why? Because they may be experiencing an acute coronary syndrome. Let's apply this clinically. A 64-year-old patient arrives in the emergency department, complaining of chest pressure, nausea, and pain radiating to the left arm. Vital signs show an elevated blood pressure, mild tachycardia, and diaphoresis. And the troponin level returns elevated. What should the nurse do? The nurse should recognize that this patient may be experiencing a myocardial injury and requires rapid cardiac evaluation and intervention. So priority nursing actions include obtaining a 12-lead ECG, continuous cardiac monitoring, assessing pain, administering medications as ordered, and closely monitoring the patient for deterioration. Before we finish, let's quickly review the key points. Troponin is a protein found in the heart muscle. It increases when the muscle becomes damaged. It is commonly elevated during a myocardial infarction, but can also increase in other conditions and should always be interpreted along with symptoms and ECG findings. And for nursing students, remember that trends, patient assessment, and prioritization are critical. If this video helped to simplify troponin for you, be sure to like this video and subscribe to Clever Concepts Academy for more nursing school and NCLEX success content. Let me know in the comments, what nursing topic would you like simplified next? Thank you so much for watching, and I'll see you in the next video.